Navigating Complexity, innovative ultrasound-guided supraclavicular brachial plexus block with dexmedetomidine in a patient with a halo device. Ladies and gentlemen, good morning. It is a great pleasure to address this esteemed audience today and captivate your attention with a topic that revolutionizes the field of medicine: anesthesia peripheral nerve block. Imagine a world where patients no longer have to endure the discomfort and risks associated with general anesthesia. With peripheral nerve block, we can offer a safer, more targeted alternative. By selectively numbing the nerves in a specific area of the body, we can ensure that patients remain pain-free throughout their surgery, while still maintaining consciousness. This is a case of a 21-year-old male from Lanao del Sur presented with a non-union of middle third humerus fracture. He had a motorbike accident 3 months prior, resulting in a broken humerus and 2 fractured cervical vertebrae without nerve damage. His neck fracture was stabilized with a cervical spine bracing or halo device. Preoperative examination showed stable vital signs and normal systemic examinations. Patient has no comorbidities, allergies, or drug use. Difficult intubation was anticipated due to halo device. The anesthesia plan for the patient was under regional anesthesia with sedation. Intraoperatively, patient secured in beach chair posture. Midazolam and fentanyl given for sedation prior to block in combination with dexmedetomidine. A preliminary scan was done to visualize the brachial plexus using ultrasound. An in-plane technique was used to inject ropivacaine 0.5% for anesthesia. Sensory block was confirmed and conscious sedation was achieved. During the nerve block procedure, the patient can be sedated with dexmedetomidine to ensure they remain calm and cooperative. The analgesic properties of dexmedetomidine can also help alleviate any discomfort experienced during the procedure. Through this combined anesthesia technique, we are able to establish an effective alternative for difficult airway brought about by the halo device. Compared to other upper arm blocks, the supraclavicular nerve block offers several advantages for humeral fractures, one of which is the targeted pain relief. The supraclavicular nerve block specifically targets the nerves responsible for transmitting pain signals from the affected area. This provides more precise and effective pain relief compared to other upper arm blocks that may not cover all the necessary nerves. Studies regarding general anesthesia on a patient with halo device are possible, but sophisticated airway devices like verbuptic laryngoscope or Pentax airway scope, AWS, are required for managing the airway in patients with limited neck motion due to a halo vest, potentially improving the safety and success of tracheal intubation. Thus, performing intubation using videolaryng or direct laryngoscope might worsen or cause further damage to cervical fracture. The importance of this case is that it reduces the need for systemic analgesics. By providing targeted pain relief, the supraclavicular nerve block can significantly reduce the need for systemic analgesics such as opioids. This can help minimize the risk of opioid-related side effects and complications. The combination of a supraclavicular nerve block and dexmedetomidine can greatly enhance patient comfort during surgical procedures. The nerve block provides effective pain relief, while dexmedetomidine offers sedation and anxiolysis, allowing patients to remain calm and cooperative throughout the procedure. Overall, the supraclavicular nerve block, when combined with dexmedetomidine, offers targeted pain relief, reduced need for systemic analgesics, improved patient comfort, suitability for patients with respiratory or cardiovascular conditions, and enhanced patient satisfaction. Combined anesthesia techniques involve the use of multiple medications and/or interventions to provide optimum patient care. Some of the most common combinations involve regional or local anesthetics working together with general agents or sedatives. The use of these combinations has made anesthetists much more successful in controlling and managing a patient's pain levels before, during, and after surgical procedures. In relation with this case, the surgical procedure lasted for 2 hours and 30 minutes and was uneventful and successful. The patient was then discharged from the PACU with stable VS and adequate pain control with a visual analog scale, VAS, score of 0, 10 and 0 on the Richmond sedation scale.
Peripheral nerve block is a safe and effective medical procedure used to reduce or stop pain during surgery. It works by temporarily blocking pain signals sent to the brain from nerves around the affected area. This block provides local anesthesia, helping improve patient comfort during and after their surgical procedure. What makes this especially beneficial is that it limits the amount of general anesthesia that has to be used, so patients are able to recover faster and more effectively. With peripheral nerve block, medical professionals can customize and target their methods to best meet the needs of the patient. This type of block has greater safety benefits, given it is specific to the patient's area of the body and type of surgical procedure. As such, there is less risk of exposure to potentially dangerous systemic side effects that can occur when general anesthetic is used. The duration of the block can be tailored to the procedure, lasting anywhere from a few hours to a few days. With peripheral nerve block, patients can receive prompt and comprehensive relief from pain during their surgery, improving their recovery after the procedure. All in all, peripheral nerve block provides a safe and effective way for medical professionals to manage pain during and following surgery, so their patients can experience maximum comfort. Dexmedetomidine is a highly effective sedative commonly used in the operating room to provide sedation and analgesia during surgical procedures. It belongs to a class of medications called alpha-2 adrenergic agonists, which work by stimulating receptors in the brain that help regulate arousal and pain perception. One of the key advantages of dexmedetomidine is its ability to provide a state of sedation that allows patients to remain calm and cooperative while still being easily arousable. Unlike other sedatives, dexmedetomidine does not cause respiratory depression, making it a safer option for patients, especially those with compromised respiratory function. Additionally, dexmedetomidine has been found to have analgesic properties, meaning it can help alleviate pain during and after surgery. This is particularly beneficial for patients undergoing procedures that may cause significant discomfort. Another advantage of dexmedetomidine is its minimal impact on cardiovascular function. Unlike other sedatives, dexmedetomidine does not cause significant changes in heart rate or blood pressure, making it a suitable option for patients with cardiovascular conditions. Furthermore, dexmedetomidine has a short half-life, allowing for rapid recovery and minimal residual sedation. This is particularly advantageous in the operating room setting, as it allows for a smooth transition to the post-operative period. Therefore, dexmedetomidine is a valuable sedative option in the operating room due to its ability to provide effective sedation, analgesia, and minimal impact on respiratory and cardiovascular function. Its short half-life and rapid recovery make it an ideal choice for surgical procedures. In conclusion, the combination of a supraclavicular nerve block and dexmedetomidine can be a highly effective approach for providing sedation and analgesia in patients undergoing open reduction and internal fixation of the humeral fracture, even with the limitation brought about by halo vest. As far as the available case reports and journals are concerned, this is the first combined anesthesia using supraclavicular nerve block and dexmedetomidine to a patient with humeral fracture while on halo device to stabilize cervical neck fracture. Here are our references. Thank you.